County. We're glad to have you along with us. Also happy to be joined this afternoon by the Warden of Middlesex County, Alison Warwick, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, and the Executive Vice President and Chief Nursing Executive at London Health Sciences Centre, Carol Young-Ritchie. As always, happy to be joined by the media who are in attendance this afternoon. We do welcome you. And if this is your first time or you haven't asked a question in a while, all you need to do is click on the Q&A icon here in Microsoft Teams. That is the question mark inside the text bubble at the top of the screen. And when you do submit those questions, if you could indicate your name as well as your media outlet and who your question is for. And finally, to those joining us this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and listeners and viewers on the CTV London website, we welcome you as well. Let's begin with our opening remarks this afternoon, and we'll start today with Middlesex County Warden Alison Warwick. Madam Warden.
Thank you, Dan. Good afternoon, everyone, on this snowy day in April. The effect of this snow upon us when we should be enjoying spring weather is much like the continuing battle against COVID and the ensuing variants. It's disheartening, but we know we now have the ability and the knowledge to deal with this variant. I'm still seeing masks being worn, hands being sanitized, and social distancing practices being followed. On a recent visit to the Agriplex last week, it was encouraging to see the amount of people coming in for their booster shots. And again, we saw an injection site run efficiently, allowing people to come in and out quickly. One person receiving her booster last week was Ontario's own Lieutenant Governor, Her Honour Elizabeth Dodswell. It was exciting for everyone in attendance to see Her Honour roll up her sleeve and receive her vaccine. Her Honour was very gracious and encouraging to the health unit staff and visitors, and was happy to speak to the people who had stopped in for a vaccine. While we're thinking about provincial leaders, I would like to take this opportunity to recognize our own Minister of Health, Christine Elliott. I would like to thank her for her hard work and dedication during her last term of office. Her work during the pandemic included willingness to go out of the box on many instances for Middlesex and London. In one instance where she showed strong support was her approval of a local campaign where our paramedics were able to visit local industries with vaccines right on site. It was a great partnership between emergency services, the provincial health services, and the industrial sector who wanted to make sure their employees were safe. Minister Elliott's approval meant that we were able to go directly to industries like McCormick's, Nestle's, and General Dynamics and get more shots in the arms of local residents right where they worked. I know I speak for all of us when I say we appreciate Minister Elliott's balanced approach to public health. Since my last appearance here, we have since celebrated the first ever Public Health Week. Again, I want to congratulate Dr. Summers and his team on their unfailing response and their ability to deal with the ever-changing circumstances over the past 2 years. And now I'm going to pass it on to Dr. Summers.
Thank you, Warden Warwick. And certainly we celebrate the provincial leadership and also our local leadership through you to the county council, to the city council as well. We are so fortunate to have such strong local leadership as we continue to weather this pandemic. The Middlesex-London Health Unit is reporting an additional 33 COVID-19 cases and no additional deaths today. Over the weekend, a total of 379 additional COVID cases and 1 additional death were reported to the Middlesex-London Health Unit. 153 cases were reported on Friday, 117 cases on Saturday, 52 cases on Sunday, and 57 cases reported yesterday, Monday. As I mentioned, 1 additional death was reported over the weekend, an individual in their 70s who was unvaccinated. I will note that that death actually occurred in the fall. It was not originally reported to the health unit, and it was through data cleansing processes that this became clear. This does happen every once in a while, but I would highlight that that death was actually reported this weekend, but did occur during the fall. COVID-19 continues to circulate and evolve in our community, and the risk remains very high. As we watch our trends over the last number of weeks, we've seen a significant rise in COVID. There is some early encouraging signs that transmission is plateauing. That is good. However, the risk of transmission still remains significantly higher than at any point in time before this Omicron wave of December 2021 onwards. This means that when you are out and about, it is essential that you use the tools within your toolbox to protect yourself and those around you relative to your risks of severe outcomes from COVID-19. And that means wearing a mask, particularly in public indoor settings. Wearing a mask does protect you against transmission, and it also protects those around you if you happen to be incubating COVID-19. You need to ensure that you are up to date for all recommended doses of the COVID-19 vaccine, which means that if you're over the age of 12, you should have a booster dose. And if you're over the age of 60, as you become eligible, you should get that 4th dose. It's also important that you stay home if you are unwell and if you develop COVID-19 symptoms. And if you test positive, stay home for at least those 5 days. As long as your symptoms are improving at that 5-day mark, you are able to come out, but otherwise you should stay at home. I would also advise at this time that you consider limiting your social interactions and keeping your social circles small relative to your own risk of severe outcomes. Consider your own risk. If you're older, you're at higher risk. If you are surrounded by people who are older, you may be putting them at higher risk. So keep your social circles a little bit smaller as we continue to weather this significantly high amount of COVID in our community. I spoke about vaccination, and I want to emphasize that the reason that we are in as good a state as we are is because of the vaccination efforts of so many. And when I say the efforts of many, I mean the willingness to roll up your sleeve and get vaccinated. The booster continues to be recommended for many, and the National Advisory Committee on Immunization last week strengthened their recommendation for a booster dose for those 18 and above. They strongly recommend that everybody 18 and older receive a dose, and those 12 to 17-year-old consider getting a booster dose. And I would expand that to say I recommend everybody over the age of 12 get a booster dose. The National Advisory Committee on Immunization updated its recommendation given the additional evidence around the profound safety of this vaccine and the additional benefit against symptomatic illness and most notably severe outcome from getting that booster dose. The primary vaccine series, so just 2 doses, is helpful, but it offers less protection against infection and symptomatic disease with the Omicron strain compared to the original strain of COVID and earlier variants like Delta. Therefore, that booster dose is essential to provide that additional protection against not only symptomatic infection, but also severe outcome. In the last number of months, our highest case counts have been amongst those ages 18 to 49. That's the group that we really need to get protected. That's where we're seeing the highest burden of illness when it comes to case counts. So please, even if you're not in one of our older age groups, it's still critical that you get vaccinated. I last just want to highlight that there is additional testing available in our region. Last week, the province announced updated eligibility criteria for accessing a COVID-19 PCR test in order to ensure that you have access to treatment if necessary. Eligible groups for PCR testing and assessment include symptomatic individuals who are over the age of 70, who are 60 years of older and have received fewer than 3 doses of the vaccine, who are severely or moderately immunocompromised, and adults aged 18 and older who have had fewer than 3 doses of the COVID-19 vaccine and have a risk condition that makes them more susceptible to severe outcomes. So there are modalities to test. The reason that we are testing those individuals is because those are the individuals who may qualify for one of the antiviral medications, specifically Paxlovid. In our region, you can visit the Carling Heights Assessment Center or talk to your healthcare provider. Primary care physicians and nurse practitioners in our region have received an abundance of information on how to assess and prescribe Paxlovid. And so please talk to them if you are in one of those age groups and you are symptomatic with COVID-19. The earlier the better in order to ensure that you get the protection you need. Thank you so much for joining us today. I hope that over the course of the next week, we do see an ongoing plateauing of the COVID cases in our region. The COVID-19 provincial science table last week did allude to a leveling off of wastewater data and COVID wastewater counts across the province. It is still early days, and we hope that that continues, but I will again express caution in getting too far ahead of ourselves. We've learned that we need to go slow when it comes to backing off of our urgency around responding to the COVID-19 pandemic. So mask up, get vaccinated. If you're sick, stay home. And for now, limit that social circle ever so much. I'm going to pass things over to the Executive Vice President and Chief Nursing Executive from London Health Sciences Centre, Carol Young-Ritchie.
Thank you very much, Dr. Summers, and good afternoon, everybody. And thank you for having me here to share an update on the COVID-19 situation at London Health Sciences Centre. As of this morning, we are caring for 56 COVID-19 positive inpatients, and we have 6 patients in critical care. Our Children's Hospital has 5 or fewer inpatients with COVID-19 and no patients with COVID-19 in our pediatric critical care. We currently have no active outbreaks, I'm happy to report. We continue to see the impact of the 6th wave on our healthcare system. This has meant a larger numbers of staff who are off due to COVID and increased number of COVID patients as well. We are adjusting staffing and doing everything we can to mitigate our health human resource challenges in order to continue to provide safe patient care. At this time, there are no formal plans to reduce our services. Finally, I'd like to share that after more than 2 years as COVID lead of Team LHSC's COVID response, I will be rotating out of my executive sponsorship position of COVID-19 operations. This will enable me to focus more fully on my responsibilities as Chief Nursing Executive. While challenging, this has been a time of immense learning for both myself and all of Team LHSC. It's been an honor to represent the team as we've navigated through challenging times with each wave. I'd like to thank my co-lead, Dr. Adam Duclos, for his support, the Mayor, as well as the team at the City of London, the Warden, and Dr. Summers, Dan, and the Middlesex Health team. I'd also like to thank our media partners. It's been a pleasure working with you over the past 2 years. Finally, I'd like to thank my fellow LHSC employees and physicians for the support they've shown me, and the support to one another. While this pandemic continues to evolve, I am confident Team LHSC will continue to care and support one another in the very important work that we do. Thank you.
Thank you, Warden Warwick, Dr. Summers, and Carol Young-Ritchie very much. And I did want to acknowledge that Carol Young-Ritchie, with today being your last virtual media briefing, it has been a pleasure to have you as part of the team. And I know if the Mayor were here today, he'd say as an important member of the cast of the show. So we will miss you for sure, and are so grateful for everything that you have shared with the community, with the media, and with us as we have continued to address these challenges associated with the pandemic. So thank you, and we will miss you very much. All right, let's go on to the questions. We do have a bunch in the queue, and again, a reminder for the media joining us this afternoon, if you do have a question for Carol Young-Ritchie, for Warden Warwick, or for Dr. Summers, just click on the question mark inside the text bubble right over the Q&A icon here on Microsoft Teams to ask your question. Just indicate your name as well as your media outlet and who your question is for. Let's go to the first question. It comes to us this afternoon from Christy Lee Varley at CTV London, and it's for Dr. Summers and or Carol Young-Ritchie. So what I may do is, if one of you would like to start, and then we'll have the other respond afterwards. Are you expecting to see an increase in cases and or hospitalizations following Easter? Who would like to start? Dr. Summers.
Thank you for that question, Christy Lee. I believe that we will continue to see ongoing transmission following the long weekend that we just had. In our experience over the pandemic, I wouldn't say that we've necessarily pinpointed rises and falls in cases specifically to an event. I think we've often looked at a long weekend or St. Patrick's Day and thought that will be a notable trigger in the risk. In fact, I think those often happen in the context of larger societal trends. So for example, it's not just Christmas Day or Christmas Eve, it's often the general move of socialization that happens throughout December that would lead to the increases we've seen over the last couple of years. Similarly, what we've seen over the last number of weeks and months is a gradual increase in socialization as public health protections have been scaled back, capacity limits have been scaled back, masking requirements have been adjusted. That is what will continue to drive changes in transmission, in addition to the ongoing increase in community immunity that we are seeing. And when I say that, what I mean is that we are likely going to start to see a decline in our cases, not because people are not socializing anymore, but because there are not so many people left to get COVID or to get protected by vaccine. And I believe that is what we are starting, hopefully, to see is a decline because there are less people who still are vulnerable to COVID-19. To your question, are we going to see an increase in cases and hospitalizations? I think it will likely, over the weekend, have seen increased opportunities for transmission that may result in cases over the next little while. Is it going to dramatically change the trend? I do not think so.
Thank you very much, Dr. Summers. Carol?
Yeah, I'll just add to that. Certainly what we've learned over the past 6 waves is LHSC continues to maintain a high degree of readiness for whatever comes. So we're really looking at the numbers every single day, our staff that are off, and balancing everything at the same time. So if we do see increased cases, we're ready for that, and we will continue to have a high degree of readiness come what may over the next months ahead.
Thank you very much. Let's move on to a follow-up question from Christy Lee Barley at CTV London. I am guessing, Dr. Summers, this is going to be for you. Generally with Omicron and the current predominant variant, how long after being exposed are people testing positive on a rapid antigen test? It seems like the previous 7 to 10 days is much shorter now.
Thanks for that question, Christy Lee. Yes, the distance and the time that elapses between being exposed and developing symptoms or becoming infectious has typically for COVID been between that 3 to 7 days. And some of the newer variants, though, have seen that move shorter. I would say with Omicron, it's been as quick as a 2-day turnaround, maybe even a little bit shorter on the short end, from being exposed to developing symptoms and becoming infectious. It largely isn't taking that 10-day maximum time anymore. It's shorter. So the turnaround time is on the whole less than 5 days, typically around the 2 to 3 day mark, if not slightly less.
All right, thank you very much. And one more question from Christy Lee, and it's for you, Dr. Summers. Do you think school boards should start reporting case counts again? If so, is this something the health unit assists with?
Thanks for that question, Christy Lee. A little bit of context to my answer. Given the significant amount of COVID-19 in the community and the pace at which Omicron moves, we are not in a position where reporting case counts in community settings like schools is an effective strategy for helping people adjust their behaviors relative to the risk. What I mean by that is that although during previous waves, knowing there was a case in a classroom was helpful, it is no longer as helpful as we think it is. We have to act as though Omicron is there because we have to assume that it is. And if you know it's there, it doesn't necessarily change what behaviors need to be in place, which is staying at home if you're sick, masking as much as you're able, making sure everybody's up to date with vaccination. So no, I do not think that the schools should start reporting case counts again. I don't believe they would be able to, given the limited access to testing that we currently have. And I also don't think it is going to be effective in helping people adjust their behaviors relative to the risk. Thanks.
Thank you, Dr. Summers. Next question is from Dan Brown at the London Free Press. And Dr. Summers, this one is for you, and it's got a lot of parts here, so we'll read through the whole thing. Dr. Summers, where are we in the curve of the 6th wave? Have we reached a plateau? Are we still on the way up towards a plateau? If I'm reading the Health Unit website correctly, there were COVID outbreaks declared in 4 care homes since Sunday. How pressing is the problem in care homes in London?
Thanks, Dan, for the question. With regards to where we are on the curve of the sixth wave, I think we will have a better sense of that by next week. The wastewater data that the Ontario Science Table released late last week from across the province suggested that the wave is plateauing. That data is consistent with what we are seeing from our case counts in the last week in the Middlesex-London region. And to my understanding, the province has seen those trends continue through the weekend, where the activity in the community does appear to be plateauing. However, it is early indications. We will have greater confidence in that conclusion near the end of the week and into next week. With regards to the outbreaks in care homes, yes, we are continuing to see outbreaks declared in care homes. We also see outbreaks resolve. And on the whole, those outbreaks are smaller in number with regards to how many people are implicated, and the morbidity and mortality, i.e. the number of people dying associated with that outbreaks, has decreased not only in our region, but across the province. And that is squarely due to vaccination. And so we have made substantial efforts in partnership with long-term care homes and retirement homes to deliver fourth doses through the late 2021 and early 2022. The third doses and fourth doses in those facilities, as well as third dose uptake amongst staff and family members, is responsible for the reduction in transmission and notably the reduction in deaths associated with outbreaks in long-term care homes and retirement homes. We will continue to see periodic outbreaks, absolutely, but we must continue to vaccinate. Masking will still be required, I think, into May, and through that, I think we will be able to weather the storm as best as we are able.
Thank you very much, Dr. Summers. We've got a follow-up question, a couple of follow-up questions from Dan Brown. Dr. Summers, what was your message to Thames Valley District School Board trustees? Do you support bringing in a mask mandate for area public schools?
Thanks for that question, Dan. My message, I did speak with the Thames Valley District School Board. I was graciously invited to attend their meeting last week with my colleague, Dr. Nin Tran, the Medical Officer of Health from Southwestern Public Health. And I spoke to the risk of COVID-19 in our community, which I've spoke to you today. I also spoke to the risks with regards to hospitalization for COVID-19 amongst children. To that end, we have seen very limited severe outcomes amongst children. And Carol Young-Ritchie's report today speaks to that. Throughout the pandemic, even through the waves, there we've seen substantial transmission amongst those under the ages of 18. We have not seen a significant number of hospitalizations, partially because of good vaccine uptake, notably amongst those 12 to 17. So I spoke to that. I spoke to the potential benefits of masking. I continue to strongly recommend masking in indoor environments as is tolerated. The reality is that masking is a helpful tool in reducing transmission. We know that. Its effectiveness is as part of a tool that is available to us. When we lose capacity limits and as we see ongoing non-masked activity beyond school environments, the impact on transmission in our community from masking in schools becomes less clear. And I shared that with the school board as well. My recommendation to the school board, as is my recommendation to organizations, is to consider the tools available to them to increase masking amongst their clients, their staff, their attendees and patrons, relative to the risk of COVID-19 to those within their facilities. And it's not an easy decision. I know that we continue to strongly recommend masking, and I know our school board partners continue to strongly recommend masking and facilitate it, and that's a really important thing. The decisions around a mandate is a separate decision. A mandate is an important tool that needs to be used appropriately when warranted. If we had a brand new variant arrive on the scene for which our population was not protected, the use of things as intense as a mandate would need to be considered. We're at a very different time now, 2.5 years into this pandemic following the Omicron wave. and therefore the decision around the use of mandates is not as clear as it once was. I hope, Dan, that covers what I spoke to the school boards about. This is a complex issue. As simple as it seems at times to wear a mask or to not wear a mask, it is not, in fact, that simple, especially when we are talking about mandates and requiring people to not have the choice. That's a big decision, and therefore one that needs to be taken with due reflection with regards to the implications, the risks and benefits. And I know that our school board colleagues, as has our elected representatives and leadership in many organizations across our region, bravely considered throughout this wave and others.
Thank you very much, Dr. Summers. Next question is for Carol Young-Ritchie, and again, it's from Dan Brown at the London Free Press. Carol Young-Ritchie, for surgeries and other procedures, what capacity is LHSC operating at today? Have you had to cancel or postpone any surgeries or procedures this week so far? And if so, how many?
Thanks for your question, Dan. Unfortunately, it's part of our reality that from time to time, we do need to cancel surgeries for many reasons, COVID-19 being one of them. Last week, we did need to cancel a limited number of surgeries based on the number of staff that we had off with COVID. This week, we are running our surgical grid at around 90%. Our occupancy is around 94%, and we haven't planned to cancel surgeries. We are watching it very closely. We are watching this day to day. I will say yesterday was a statutory holiday for us. So again, we're watching our numbers every day and making sure that we can deliver that care as we can safely. At this time, we have no plans to cancel any surgical procedures.
Thank you very much, Carol. Let's go to what is right now our final question. So just a reminder for the media in attendance, if you do have any more questions, now would be the time to get them in. Don't wait. We've got time for one or two more, but right now we only have one left, and it is for Dr. Summers, and it's touching on something you were mentioning just before, and related question, but a little different. And it's from Sophia Rodriguez at CBC London. Dr. Summers, Thames Valley District School Board trustees will be meeting tonight to vote on mandatory masking at schools. What would you advise trustees to do?
Thanks for that question, Sophia. And building off of my previous comments, I would say what I said to the board last week, which is that the risk of COVID-19 in our community remains very high. The risk of hospitalization and death amongst those under the ages of 18 remains relatively low. However, kids can still get sick and miss school from COVID-19, as we have seen. Masking is known and is seen to reduce transmission. We are seeing transmission throughout our community. It is likely happening in classroom environments, but it is most certainly also happening in the social, unmonitored environments that students are in evenings and weekends. I continue to strongly recommend masking for people to consider when in indoor public environments, as for many, it is a non-impactful intervention that's easy to do, and one that I think organizations should do as much as they can to enable. And I continue to encourage organizations to consider the tools available to them to increase masking amongst their patron staff attendees as relevant and as related to the risk of COVID-19 amongst people in their care.
Thank you very much, Dr. Summers. And that brings us to the end of our questions for this afternoon's virtual media briefing. Thank you so much for your insight, your information, Warden Warwick, Dr. Summers, and Ms. Young-Ritchie. And again, to Carol Young-Ritchie, thank you for all of your participation over the many months of our virtual media briefings. We'll miss you. That's it for us for today. Thank you again for joining us. We'll be back with our next virtual media briefing. That is coming up next Monday, which will be the 25th of April at 2 p.m. We look forward to seeing you then. Thank you for joining us today. Have a great rest of the week, and so long for now.